Okay, so picking up where we left off, this is taking a look now at incidence of diagnosed diabetes. So what we looked at before was just the prevalence, those currently living with diabetes. Now this is looking at those that were estimated to be diagnosed in 2017 to 2018. So this would be the number in thousands, and then this would be the rate per 1,000. So basically in total in 2017 to 2018, it was estimated that about 7 per 1,000 people. So for every 1,000 people, 7 of them would be newly diagnosed in 2018. And as we look at these numbers, and I kind of like to look at the rate per 1,000, we see again that rate increases with age. We see a higher rate among men than women, and then we also see the higher rates among among Hispanic. Black, non-Hispanic, and Asians are kind of tied, and then the lowest rate per 1,000 is among white non-Hispanics. And when we look at the trends in incidence, one of the things that we did see up to about 2017 was a decrease. So we saw kind of an increase all the way up to 2008, a decrease in incidence, a slight increase, a decrease, and now it's kind of coming back up. So really what we can say is from 2016 to 2018, that sort of decline has leveled off, and we're kind of in a trajectory that looks like we might be increasing or at least staying about at the same age-adjusted incidence rate that we have been seeing. So it's not, at this point, what we can say is it's not getting worse, but it also isn't really getting any better. When we look at in youth, so we're going to look at type 1 and type 2 among 0 to 19 and then 10 to 19, because typically type 2 isn't diagnosed in children until a little bit older. Some of the things that we want to see here is also we're going to look at race and ethnicities, but first I want you to look at the overall line. One of the things that you'll notice with type 2 is it is on an increase, so it's been steadily increasing through 2015. It looks like it might be leveling off in the terms of incidence per 100,000, but it has been increasing. For type 1 diabetics, it's been about the same. Okay, when we look at race and ethnicities, we see for Black non-Hispanic children, type 2 diabetes is significantly on the rise in terms of incidence, followed by Hispanics, then the Asian non-Hispanic population, and then white non-Hispanic. When we look here at type 1 diabetes, for the most part, it's been about the same, with the exception of higher amounts in Black non-Hispanic and in Asian non-Hispanic individuals over time. So this is going to be important to come back to and think about, because type 1 and type 2 are two very different diseases that we're going to discuss in a few minutes. But this is kind of showing you sort of where we're at. And in type 1, in general, this is kind of leveled off a little bit more, kind of staying at a steady, similar rate, no real change. Some increases in Black non-Hispanic and Asian non-Hispanic. It's type 2 that we're seeing an increase across all race and ethnicities with the exception of white non-Hispanic, and in total we're seeing an increase. This is looking at prediabetes. Now, prediabetes is a new indicator that we're looking at, and there's a couple reasons why we look at prediabetes. Prediabetes are individuals where blood glucose levels are higher, but they're not high enough to be considered diabetic. This is a prime time for primary intervention. This is sort of that susceptibility range. We can, in prediabetes and very early diagnosis of diabetes, reverse it with the right lifestyle changes, and we'll talk about that here in a minute. This gives you pre-diabetic numbers down below and how we categorize a pre-diabetic. It's an individual with 100 to 125 or hemoglobin A1C values from 5.7 to 6.4%. This is important to understand because there are several individuals in our country that are living with pre-diabetes. And this is a group of individuals that, if left untreated, left without any sort of prevention, will end up with diabetes. And I want to take a look at this. here. So the estimates in millions is estimated about 88 million people in 2018 were pre-diabetic. This is not diabetics. So when we think back to that number, we had about 26 million individuals, or if we really looked at the undiagnosed together, we had about 34 million living with diabetes. And then we have another 88 million that are pre-diabetic on their way to diabetes, right? So when you put those two together, we're looking at over 100 million people in our population, a good percentage of our population at risk for or having diabetes. When you look at that percentage, it's about 34.5% of our population is pre-diabetic, okay? Over a third of our population is on track to having diabetes. The next question is prediabetes awareness. Who was aware of prediabetes based on self-report? And it was only looked at among adults. Only about 15.3% actually were aware of prediabetes. So that's less than half of those that were pre-diabetic actually being aware of that. One of the things that we'll notice is the individuals that the age group that has the highest pre-diabetic rate is 45 to 64 in terms of those percentages. But one of the things we do see is prediabetes does increase with age when we look at percentage. And so this is kind of a better number to kind of look at. So it does increase with age. And as far as awareness, the amount of awareness also increases with age, okay? So people are becoming more aware of their need to be tested at that point. When we look at men versus women, again, looking at those percentages kind of gives us a little bit better of an estimate here. Slightly more males than females in that 2016, but more women are aware than males of prediabetes status. And when we look at race and ethnicity, and we look at those numbers again, we're seeing Black, non-Hispanic, Hispanic, and Asian, kind of that same trend that we saw before. When we look at awareness, one of the things that we will also see is a similar trend where Black, non-Hispanic, Hispanic, and then Asians are aware of those prediabetes, although again, those numbers are about half of what the actual percentages are. And then looking at those numbers, a large amount in millions are actually experiencing prediabetes. But it's hard to compare because it's better to look at percentages because you're looking at total population in that sense there. When we look at the number and rate of emergency department visits, this is looking at those that have diabetes. What's the likelihood of them needing an emergency room? And I like to look at the crude rates per 1,000, just a little bit easier to look and compare. Some of the things that you'll look at in terms of diabetes with hypoglycemic crisis, about 9.7 per 1,000 diabetics are experiencing a hemoglycemic crisis. 10.2 might experience a hypoglycemic event. And in total, what we're seeing is about 69.1 per 1,000 diabetics, okay, are experiencing a emergency room visit. And this was just kind of showing you what those reasons were, but about 69.1 per 1,000 diabetics are experiencing needing to see a emergency room visit, which would be very costly for the individual. When we look at hospitalizations for individuals with diabetes, we're seeing about 339 per 1,000 and diabetics end up using the hospital or needing a hospitalization. And it breaks it down here. Cardiovascular disease is going to be the primary reason for hospitalization. Then we see a hypoglycemic crisis again, and then we see 5.6 for lower extremity amputation or hypoglycemia. So it kind of just shows you that there's a high rate of those that have diabetes presenting to the emergency room and needing hospitalization, making it a high costly disease. And also very much because of the uncontrollableness that occurs with people with diabetes. So one of the things we're going to talk about at the end of this lecture is not just the rates of diabetes, to understand the scope, and not just about the pathology, but we're also going to talk about how do people do with preventing and managing diabetes, and what do we need to do better in to really improve the health of our country. We're going to be going through a series of slides now. There's about 24 slides that we're actually going to go through quite quickly, because what I want to really do right now is I'm going to begin to show you some data as it relates to the risk factors for diabetes and individuals' ability to control or prevent diabetes. And then I'm going to take a look at statistics as it relates to individuals managing their diabetes and the comorbidities that come from it. So these next series of slides is going to look at and compare obesity and diabetes over time. And I'm going to go through this, and I want you to pay attention, because it's quite striking when you look at this, and then we'll kind of conclude with sort of some ideas as it relates to obesity. So I just want you to be watching this. These slides are going to go through animated. So you're watching these from 1994, and we're going to watch it all the way up through 2016. And you can see this, and I want you to look here, diabetes here, and look at obesity. Okay, so obesity, as you watch this, right, would come before diabetes. Okay, and as you can see, we're slowly moving forward here. And you can see that obesity rates increase, diabetes rates. It's slight lag behind for diabetes, which should make sense, because obesity, we'll talk a little bit about it, but obesity is the primary underlying cause of type 2 diabetes development. And so there's going to be a little bit of a lag time between the risk factor and diabetes. And this just kind of shows you, this is obesity over time, and there, look at your diabetes over time. Okay, so I encourage you to watch that segment again. That was about 24 slides here. So I do encourage you to take a look at that and review it again. But if you can just see here, here's our obesity rates, and just kind of look at some of these states. Look at like Ohio and Pennsylvania. Just kind of center in on this Midwest here, and you'll see sort of obesity is becoming more prevalent, and diabetes is starting to become a little more prevalent. You see a greater prevalence of obesity, a little bit more greater prevalence of diabetes, an even greater prevalence of obesity, greater prevalence of diabetes. A little bit of a lag in between, but this is largely because obesity would come first, and then the diagnosis of the disease coming after that. We already know that diabetes is a comorbidity or of obesity. And I think that data is quite striking, because it shows us that obesity, and one of the things we've noticed when we looked at these graphs superimposed, is that obesity is a large culprit of the development of diabetes. So then the question became, okay, this is a risk factor. What then are the risk factors for obesity that could also be risk factors for diabetes, and how can we then work to prevent this? So this data shows us the factors associated with diabetes-related complications among adults that have diagnosed diabetes. So we're going to first focus on those diagnosed with diabetes, and what factors do we know of that not only these also lead to the development of diabetes, but lead to very high complications in diabetic patients. And the first one we're going to look at is smoking. Smoking is one of the risk factors for complications in diabetics. And you can see here about 21.6% of diabetics are current tobacco users, and about 15% are current cigarette smokers. Look at this when you look at BMI. About 89% are either overweight or obese among diabetics. And then when you see here, about 46% of them are considered obese. And if you add these two together, we're looking at about, let's see here, 61% of the 89 are obese individuals. So largely obese. 38% are inactive. Okay. 68% have high blood pressure. We have looking at non-HDL cholesterol at varying levels, about 43% have non-HDL cholesterol higher than 130. And again, these are going to be impacted because of obesity and physical inactivity.